SIDNEY was a phase 1/2 trial enrolling patients who were HLA-A2 positive with relapsed and refractory follicular or marginal zone lymphoma who had received at least one prior line of therapy. So let me go back to describe the sequence of treatment for patients treated in cohort 4, which is the cohort that we treated 15 patients, and that's the same cohort that we will be expanding to treat additional patients with follicular lymphoma. So in cohort 4, patients start with the peptide vaccine in the priming phase, which is every 2 weeks. And this priming phase lasts for 4 doses. The peptide vaccine then continues on a maintenance phase once a month for a total of 15 doses. On top of that peptide vaccine, Lenalidomide starts at week 1, meaning together with the peptide vaccine, and it's given on a standard schedule at the dose of 20 milligrams, standard schedule being once a day for 21 days out of a 28-day cycle, so 3 weeks on, 1 week off. The lenalidomide duration of treatments is 12 cycles or 1 year. In cohort 4, for the patients who came up until this point, we have started rituximab at week 19, and only if the patient did not achieve a complete response. So there's an option for the investigator to withhold rituximab if the patient was able to achieve a complete response only with the lenalidomide and the vaccine alone. If not, on week 19, the rituximab would be started, and the dose would be as per the augment study. So once a week for 4 doses, and then every 4 weeks for 4 additional doses, for a total of 8 injections. For the upcoming protocol amendment, rituximab will be starting at week 7 instead of week 19. And that is to bring the rituximab a little bit earlier to facilitate avoiding to have patients progressing too early and having to come off study when potentially they could still benefit from staying on the study a little longer while their immunity is being boosted by the peptide vaccine. So this study, the SIDNEY study, actually had a cohort, which was cohort 2, in which the peptide vaccine was tested alone in patients who were candidates for watchful waiting or observation. So these were patients with follicular or marginal zone lymphoma who did not have a straightforward indication for treatment, and they received the peptide vaccine by itself. We're hoping to be able to share the results of that cohort 2 very soon. But suffice to say that the preliminary data indicates that there is anti-tumor activity when the peptide vaccine is used alone. That cohort has already completed accrual, and we are not planning to expand as of this time. The cohort that will be expanding is cohort 4, and that's for patients with relapsed or refractory follicular lymphoma. So the additional patients who will be recruited for cohort 4 will only have follicular lymphoma. So that's the only histology we'll be expanding for a total of 40 patients with that indication. We do believe the peptide vaccine has the potential to be synergistic with other therapies, including potentially cellular therapy, radiation therapy, and other immunomodulatory therapies. At this time, the study will be focusing on the relapsed refractory population, but I think future studies will be able to explore the potential for boosting lymphoma-specific immunity in other contexts.